Lesson number 2, cardiac emergencies and giving CPR. The first topic is heart attack. So a heart attack occurs when blood flow to part of the heart muscle is blocked, causing cells to die and leading to permanent damage of the heart muscle. Seeking advanced medical care as soon as the signs and symptoms of a heart attack are recognized minimizes damage to the heart and may save the person's life. Here's a great video explaining heart attack.
Being able to recognize when a person is having a heart attack can be a life-saving skill. Signs and symptoms of a heart attack vary from person to person and can be different in women than they are in men. Even people who have had a heart attack before may not have the same signs and symptoms with a second heart attack. Chest pain, pressure, and discomfort are the classic signs of a heart attack. The pain can range from mild to unbearable. The person might describe the pain as tightening, squeezing, or severe pressure. The pain may last longer than 3 to 5 minutes or go away and then come back. Although the pain may feel similar to that of a muscle spasm or indigestion, resting or taking medication does not relieve the pain. The pain may spread to one or both arms, the back, the upper part of the stomach, or the neck and jaw. The person's appearance and behavior may also offer clues. The person's skin may look pale or slightly grayish or bluish, and the person may be sweating heavily. The person may be having trouble breathing and feel short of breath. Some people become dizzy or lightheaded, or feel nauseous or vomit. Others may become unresponsive. Many people who have had a heart attack say that they felt anxious, like something really bad was happening. Others describe feeling unusually tired for a period of time leading up to the heart attack. Trust your instincts and seek advanced medical care immediately when you recognize the signs and symptoms of a heart attack.
All right, so some review on that video. What are the signs and symptoms of a heart attack? Signs and symptoms include chest pain, discomfort, pressure, or squeezing that lasts longer than 3 to 5 minutes and is not relieved by resting, changing position, or taking medication. Or sometimes it could even go away and then come back. Another sign or symptom includes discomfort or pain that spreads to one or both arms, the back, the shoulder, the neck, the jaw, or the upper part of the stomach. But in addition to those main ones, you can also experience dizziness or lightheadedness, trouble breathing, including noisy breathing, shortness of breath and breathing that is faster than normal, nausea or vomiting, pale or ashen gray skin, sweating, a feeling of anxiety or impending doom, extreme fatigue, or unresponsiveness. People may experience the signs and symptoms of a heart attack differently, and not everyone will have every sign or symptom. People who have had a heart attack before may not experience the same signs and symptoms if they have a second heart attack. As you can see, because of all these symptoms that might be difficult to identify at times, if there's ever a doubt that someone's having a heart attack, definitely go ahead and call 911. In general, they say that men often have what's called the classic signs and symptoms of heart attack, such as chest pain that radiates down one arm, while women often experience milder chest pain or more general signs and symptoms, such as shortness of breath, nausea or vomiting, extreme fatigue, and dizziness or lightheadedness. If you think that a person might be having a heart attack, call 911, be prepared to give CPR, and you could help them to rest in a comfortable position and loosen any tight clothing. In addition, you can offer to get any prescribed medication the person may take for chest pain and assist them with taking it if necessary. Reassure the person and monitor his or her condition until EMS personnel arrive and take over. So our next topic is cardiac arrest and the cardiac chain of survival. So cardiac arrest occurs when the heart stops beating or beats too ineffectively to circulate blood to the brain and other vital organs. Cardiac arrest frequently happens suddenly without any signs and symptoms. So causes of cardiac arrest include cardiovascular disease, breathing emergencies such as drowning and choking, severe trauma, electric shock, and drug overdose. Although a heart attack can lead to cardiac arrest, the two conditions are different. A person in cardiac arrest is not responsive, not breathing, and has no heartbeat. And here is another video, this time on cardiac arrest.
When a person is in cardiac arrest, quick action is crucial. The cardiac chain of survival describes 5 actions that, when taken, increase a person's likelihood of surviving cardiac arrest. You have a major role in completing the first 3 actions. The first link in the cardiac chain of survival for adults is recognition of cardiac arrest and activation of the Emergency Medical Services (EMS) system. The sooner you recognize that a person is in cardiac arrest and call 911 or the designated emergency number, the sooner advanced medical personnel will arrive. Early CPR is the second link. CPR helps to circulate oxygen-containing blood to the brain and other vital organs, helping to prevent brain damage and death. The third link is early defibrillation. The electrical shock delivered by an AED may restore an effective heart rhythm, significantly increasing the person's chances for survival. The fourth link is early advanced life support, which is provided by EMS personnel at the scene and on the way to the hospital. Integrated post-cardiac arrest care is the final link. After the person is resuscitated, an interdisciplinary team of medical professionals works to stabilize the person's medical condition, minimize complications, and diagnose and treat the underlying cause of the cardiac arrest. 4 out of every 5 cardiac arrests in the United States occur outside of the hospital. When you complete the first 3 links in the cardiac chain of survival, recognizing cardiac arrest and activating the EMS system, immediately beginning CPR, and using an AED as soon as possible, you can make the difference between life and death for a person in cardiac arrest.
And that transitions us into our next topic, which is giving CPR. So there are CPR dummies that are available to use. If you do use them, please make sure to clean before and after. And I will say that for the time being, we're not doing the mouth-to-mouth portion. So please do not do that part.
Hey, are you okay?
After confirming that someone is unresponsive and not breathing or only gasping, assume cardiac arrest and begin CPR.
He's unresponsive. Go
Ensure the person is on his back on a firm, flat surface such as the ground. Next, kneel beside him and place the heel of one hand in the center of his chest, with your other hand on top. Interlace your fingers and make sure they are up off the chest. Position your body so that your shoulders are directly over your hands. With this technique, you can use your body weight to help compress the chest. Now, give 30 chest compressions. Keeping your arms straight, push down at least 2 inches, then let the chest return to its normal position. Continue to push hard and fast, giving compressions at a rate of between 100 and 120 compressions per minute. Next, give 2 rescue breaths. First, place a breathing barrier over the person's nose and mouth. Then, open the airway by putting one hand on the forehead and 2 fingers on the bony part of the chin and tilting the head back to a pass-neutral position. Pinch the nose shut, take a normal breath, and make a complete seal over the person's mouth with your mouth. Blow for about 1 second while looking to see that the chest rises. Take another breath, make a seal, and give a second rescue breath. Continue giving sets of 30 chest compressions and 2 rescue breaths until you notice an obvious sign of life. An AED is ready to use and no other trained responders are available. You have performed 5 sets of CPR and another trained responder is available to switch. EMS personnel take over. You are alone and too tired to continue, or the scene becomes unsafe.
And then we have another great video that is helpful to practice while you watch it. I do encourage you to rewind if you feel the need to go through it again. And here it is.
Okay, it's your turn to practice 5 cycles of chest compressions and rescue breaths. Begin by kneeling beside your mannequin with your gloves on and your breathing barrier nearby. Next, place your hands on the center of the mannequin's chest. Make sure your fingers are interlaced and off the mannequin's chest. Your shoulders are directly over your hands and your arms are straight. Count out loud and keep pace with the metronome while giving 30 compressions. Ready? Begin.
1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 25, 26, 27, 28, 29, 30.
Good. Now place the breathing barrier and open the airway. Pinch the nose, make a seal, and give 2 rescue breaths. Immediately give another 30 chest compressions. Remember, compress at a rate of 100 to 120 compressions per minute and a depth of at least 2 inches for an adult.
23, 24, 25, 26, 27, 28, 29, 30.
Great job. Now, open the airway and give 2 rescue breaths. Now back to chest compressions.
1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12, 13, 14, 15, 16,
Remember,
17, 18,
push hard
19,
and
20,
fast.
21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
You got this. Okay, 2 more rescue breaths. Keep going. Give another set of 30 compressions and 2 rescue breaths.
7 and 8 and 9 and 10 and 11 and 12, 13.
Remember,
14, 15,
allow the chest to
16,
return to its normal
17,
position
18,
after
20,
each compression.
22, 23, 24, 25, 26, 27, 28, 29, 30.
Last set of compressions.
4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27,
You're almost
28,
there.
29, 30.
Finish with 2 rescue breaths. Good. You can now take a rest.
All right, so you probably experienced how tiring that can be. We're going to move on to our next topic, which is if the chest does not rise with breaths. So if the first rescue breath does not cause the chest to rise, retilt the head to ensure that the airway is properly opened and ensure that the person's nose and mouth are properly sealed before giving the second rescue breath. If the second rescue breath does not make the chest rise, an object may be blocking the person's airway. If the second rescue breath does not go in, immediately start the next set of compressions. Remember, you never attempt more than 2 rescue breaths between sets of compressions. After the set of compressions and before giving rescue breaths, open the person's mouth, look for an object in the mouth, and if you see it, remove it. To remove the object, do a finger sweep. Be sure that you actually see the object in the person's mouth before attempting to remove it. After removing the object, give 2 rescue breaths. And here's another video, great example on what to do if the chest does not rise with breaths.
When giving breaths, the chest should rise. However, you might encounter a situation where the chest does not rise. If the chest does not rise on the first breath, reopen the airway, make a seal, and try a second breath. If the chest does not rise on the second breath, an object might be blocking the airway. Immediately begin the next set of chest compressions.
15, 16, 17, 18, 19, 20, 23, 24, 25.
Before attempting rescue breaths, open the mouth and look for an object. If you see an object, remove it with a finger sweep. For an adult, use your index finger. Give 2 rescue breaths and continue CPR.
One and 2 and 3 and 4.
All right, and the next topic is compression-only CPR. This is very relevant to the current times just because with this, you're not doing the mouth-to-mouth portion. A lot of times you might not want to do that portion especially with the virus going around. This is another option to do. So if you're unable or unwilling for any reason to perform full CPR, you're going to give continuous chest compressions at a rate of 100 to 120 per minute. So that same rate. And you're going to do that after calling 911. Continue giving chest compressions until another trained responder or EMS personnel take over, or you notice an obvious sign of life. All right, and that's the end of that section.